When they first hear this diagnosis, most of the patients get shocked and very surprised because cancer is an illness which has a death risk, and it's very hard for a person to come into face with such an illness which has a death risk. Because normally every people know that we will die one day, but none of us lives like we can die anytime. And we always forget about we're gonna die and we survive like that. We don't think about it, we don't want to remember that truth. Although we know we will die, we make future plans and think about other things to do in life. But when you come face to face with such a death risk, it's so scary for the person because suddenly it pops up. They suddenly find something in their bodies, and most of the cancers don't give a symptom. If it's not in a bad condition, then you don't feel it in your body, and it suddenly pops up in your body. And it's very scary and hard to accept this. People get very scared, they get a shock and they deny the fact that they have a cancer. They can't accept it because it's hard to accept such a truth. Some of them don't use the word cancer. Some of them say that it's going to be something good or it's not the right diagnosis and they go to some other doctors. It takes a while to accept the fact. And after denying it and being in a shock, they have a period of anger. They get very angry about why they got cancer, why it's them to have cancer, why not somebody else but them they have it. It really makes the patient very sad and they can't understand. And they're trying to make a solution and they're trying to give it a meaning. Like they're trying to search for a reason. Because in life, we always try to find a reason for the things that happens to us, but it's not always possible to find a reason for cancer, because sometimes it doesn't have a reason. Even if you don't smoke, even if your family members doesn't have cancer, and even if you eat healthy food and do sports and all that, you can still have cancer. It doesn't have a formula. And because of that, patients have a hard time to deal with this fact, and they think about so many things and they get very angry about life, and because they think that they did everything right but something went wrong and they didn't deserve it. After that anger period, sometimes they get into depression. They get very depressed and they have some hard times psychologically. Some of them get anxious. They have high anxiety, and but after that period, some of the patients accept the diagnosis, and when they accept the diagnosis, psychologically they get older. I mean they know what life means, and they're trying to get as much as pleasure as they can. And they try to have happier moments in their lives, and they sometimes be even happier than their previous life because they know the worth of every moment in the life. But some of the patients, they get into depression, and some of them they get anxiety disorders, and if they have a disorder, of course they need to have a psychological help.